Hello, I'm Dr. Adelkopf of Creative Natural Health. If you're watching this video now, that probably means that you or somebody you care about deeply is suffering with peripheral neuropathy, nerve pain, numbness, tingling, feeling like the socks are bunched up under your feet but you're not even wearing shoes. Peripheral neuropathy is a progressive condition that will become debilitating if not treated properly. So I urge you to watch this video all the way through because I'm going to explain to you right now how hundreds of thousands of people across the country are reversing their neuropathy naturally without drugs and their side effects. These people are regaining their lives and relationships. So let's get started. Peripheral neuropathy is a condition that has over 100 causes, diabetes being the most well-known, but cancer treatment causes it. Back injuries can cause it. Neuropathy is caused by statin drugs for cholesterol, and the list goes on and on. But regardless of the cause, people suffering with any kind of neuropathy feel the symptoms for the exact same reasons. There's a common misconception that neuropathy is a nerve problem. Well, it is, but actually it's a vascular problem that affects the nerves. So let me explain that. My hand is going to represent a nerve cell. We have millions of them in our body. The palm of my hand is the body of the nerve cell that does all the great things that nerve cells do. My fingers are the little blood vessels that supply the nerve with oxygen and nutrients. The blood vessels also supply the nerve or allow the nerve to remove toxins. The blood vessels basically allow the nerve cell to do all the miraculous things that nerve cells do. But long before you and millions of people like you feel symptoms, these little blood vessels around the nerve cells start to shrink up and at some point cause the nerve cells to start having problems breathing, meaning that the nerve cell can no longer get oxygen and nutrients in and out of itself. So people who have neuropathy, once symptoms come on, may look online for help. They may call their family doctor and get referrals to specialists. Specialists may likely order special tests, some of which are quite painful. Medications are prescribed like gabapentin, Lyrica, Cymbalta, and various types of antidepressants, and the list goes on and on. But in every case, again, it comes back to the loss of blood flow. Now, our bodies make new blood vessels every single day. It's called angiogenesis. Just a big fancy word meaning that our body makes new blood cells. If we get a cut, the blood vessels heal and grow back. The heart creates alternate circulation when needed. Millions of our doctors know how the body performs this task. So what do we do for our patients with neuropathy? Let me explain. We activate the body's natural ability to regrow damaged blood vessels without any drugs, surgeries, or injections. This process is over 90% successful nationwide. Now, if I told you that if you went out and bought a lottery ticket today that you'd have a 90% chance of winning, I bet you'd go out and buy a lottery ticket, right? And believe me, I understand. I've been in healthcare for a very long time. Most neuropathy patients are told that they can't get better, that there is no cure, that they just have to deal with the symptoms. But what it comes down to is the root cause of the problem, and that's the loss of circulation because of the destruction of the blood vessels. As more time goes by, more and more blood vessels are destroyed, and the nerve cells shrivel up and eventually die. It doesn't have to happen though. Please, I urge you, get that lottery ticket. And what I mean by this is come in and see us. We've successfully helped so many people in your situation who didn't know there was an answer. If you continue to just medicate the symptoms and not address the loss of blood flow around the nerve cell, nothing is going to change. In fact, the neuropathy will just get worse. But here's the amazing thing. If you're a good candidate for what we do and fortunate enough to be offered a position in our program, the vast majority of patients accepted for care see noticeable results and lasting improvements in just a few weeks. It only gets better from there. It's not hard. It's just that we don't know what we don't know. And that's why I'm here talking to you today. So thank you for coming this far. If you've scheduled an appointment, please keep it. There's a great chance that we're going to be able to help you. If you're not sure and you're still on the fence because your doctor said this or your doctor said that, well, they say the definition of insanity is doing the same thing over and over again and expecting a different result. Are you getting a different result from anything you've tried so far? Make an appointment. I assure you, if you're a candidate for what we do, your life is going to change for the better. You're going to regain function. You're going to be able to enjoy the things that maybe you haven't been able to enjoy for a very long time. So again, here are the main points. Peripheral neuropathy is a disease of the blood vessels shrinking up around the nerves. The nerve cells can't breathe. That brings on pain, tingling, numbness. Eventually it feels like you have two bricks attached to your ankles. Balance is affected, falls become a problem, sleep becomes a problem. Doing the things we love becomes a problem. It affects every aspect of our lives. So please, I look forward to seeing you and letting you know if we can help you. There's over a 90% chance that we can. I look forward to seeing you soon and having you become one of our next success stories. Thank you so much, and goodbye for now.